Hi guys, I'm Adam Nicholson. I'm from the University of Wisconsin, and I'm going to talk about advising the emergency medicine-bound student, which I think is probably one of the more fun things that we get to do. I'm going to talk just a little bit about what our advising looks like. I'll say this is really going to depend on what your institution looks like, what your numbers look like, what your team looks like. So in the 3 years I've been at the University of Wisconsin, we've had anywhere from about 12 to 25 students going into emergency medicine. And our team has consisted of about 3 faculty that are just on our medical student team. So we start everything out with a big group advising session about January prior to the year that those students would match. And we involve our residency leadership team, we involve our vice chair of education, and we basically take these students through what is a SLO, what's your application process going to look like, how do you succeed on your rotations, when should you do your rotation, when should you do your away rotation, and kind of go over those kind of things. After that, we do a similar thing to what Joe was talking about, where we kind of have an advising form or like an intake interview with all of our students that think they're going to go into emergency medicine. And we start ironing out like kind of the nuts and bolts of what their application is going to look like. Do you have your PhD? Are you like a fervent researcher in emergency medicine? What were your STEP scores? Do you have any professionalism concerns that you want to disclose to us that are going to shape your application cycle? How's your clinical performance been so far? And that way we kind of know, like right off the bat, how to advise these students on maybe this student should do their rotation a little bit early, maybe this person should do it a little bit later, maybe this would be a great place for you to do an away rotation. Maybe we need to think about your application as, if this doesn't go really well on your rotation, maybe we need to think about like a dual application strategy. So kind of just knowing who they are as a person to start with. So that's our pre-rotation. During the rotation, we have about a 20 to 30 minute meeting halfway through where we look at all the objective data that they have so far, and we call this like our mid-month feedback. And we kind of go over their NCAT, we kind of go over their comments, and we talk to them about how things are going, and we provide that feedback to them so that they can kind of continue on their growth pattern and know what we're thinking about them in terms of where they'll fall on, and kind of what their SLO may look like as of that point in time. And then we inevitably end up having like 1 to 2 meetings with the student after their away rotation, specifically going over where are you applying, please send me your list. Okay, I'm gonna make edits on your list, I want 10 more programs, 10 less programs. That's gonna really depend on how the applicant looks, and there's a ton of variables that will go into that as well. I think, kind of the benefits of all this is you really get to know a student over the course of the year, which I think is why we all do this, and you get to build a relationship with your mentees. I think the cons is this is a really time-consuming way to do this. So if you're one person advising 20 students, this model probably isn't going to work perfectly well for you. So you may need to enlist in some more help or kind of find ways to streamline some of your advising. Advising students is really hard, similar to teaching medical students, right? Every student is different. Every year we run into students that do a great job listening to our advice, and every year we have 1 or 2 students that just it's like talking to a brick wall. I can't get them to respond to my emails. I can't get them to give what they're supposed to. And so that can be the challenging part. I think kind of standardizing our approach as to here's what we want out of you, and we're very upfront that this is going to be a back and forth over the course of the next 16 months, and we are going to need you to be diligent in terms of administratively responding to us, and then kind of creating just a composite of the data so that we know who these students are. We're going to go over just a couple of scenarios as to how to help advise students. We're going to skip the student that previously had scored a 290 on step 1 and has their PhD and is like a extrovert and is going to interview at 15 programs and going to be ranked on the top 10, because I think that's a pretty easy student to advise. We're going to talk about maybe a little bit more difficult scenarios. So let's start just talking about the average student, right, which we're going to do a lot of advising for this student. I think one thing that can be really helpful, and we've talked about this at a couple lectures, is letting the students know where we think objectively they're falling. And so that's kind of, to me, the benefit of giving them feedback while they're on the rotation is, hey, I have my NCATs filled out from you from 5 shifts. This is where faculty and residents think you fall compared to your peers. And this is what I think of your peer group. I think you have a really strong peer group, but it seems like you're middle of the third, and just kind of letting them know that that's kind of where their data is trending can be really helpful for them. I also try to, when I'm having like these meetings with the average student, kind of get a sense as to like, what do they want to get out of residency? I think that's a helpful thing. So you can start like at, figuring out where your advice is. If they're like, I would like to live in Seattle or Oregon only, and that's my only thing, then it's like, okay, well, I need to adjust your expectations of what your match cycle may look like. Other than that, does anybody else have any advice for giving advice to their average students? Anybody else have problems giving advice to their average students?
So one thing I tell the students is, like you said, everybody's individualized, so don't talk to your friend, because what I'm telling them is going to be different from what I'm telling you. And then I also warn them what med school says is going to be different than what I say as well. So I've had students like, well, the med school said I should apply to 50 programs. I'm like, yeah, that's because their goal is to, like, they want to make sure you match, because that's one of the things that's metric. So they're going to tell you to apply to 20 programs, interview at top programs, because it's going to increase your chance. So I do try to see, what's the med school saying. And like I said, yes, the online is going to say the average student applies for 100 programs. Yeah, that's not true. You don't need to apply to that many programs. So yeah, and like I said, same sort of thing. Like, the person sitting next to you, I'm going to tell them something different than what I tell you. Because again, maybe they want to go to have to be in the Northeast versus I have to be in the Northwest versus I could be anywhere, sort of thing.
Yeah. I think that's a really good point too, because sometimes I'll have, like I'll be like, hey, I think this program is too competitive for you, and then I tell the next student, I was like, I don't think this is a program that you need to put on your list, kind of thing. I think the other problem with the average student is the average student that we see has gotten a lot of really positive verbal feedback. We do end of the shift evaluations with these, so they've heard a lot of really good things about them, and everybody thinks they're top 10%, top third, and then all of a sudden you're like, oh, we'll talk about the below average student next. And those students usually kind of know that something is coming. I find very rarely that does a below average student think they're going to be like a top 10% type of student.
Students, my understanding is that students have very poor perceptions of their performance in general. Right? Everybody thinks that they are higher than they are. And I think being the sort of average genius is like kind of the universal experience of most medical students. The couple things I tell them is like, one, there are programs out there that would kill for an average student. And two, you're in really good company, right? There's lots of other students that have, like, most other students are in your position, like the majority, so you're not alone. And three, like, highlight the things that you're really good at.
Yeah.
So if you are, what was it, with research, or you're a particularly nice person or whatever, focus on those.
Yeah. Yeah, I similarly have students with like the Lake Wobegon effect, where everything is good, everything is great, especially because I'm in the Midwest and nobody really wants to give bad news to people. I'll also tell the students, we'll take a look at this loan, I say, hey, I'm going to put X number in the top 10, X percentage in the top 10%, X percentage in the top third, X in the middle third. Somebody's going to be in the middle third. I still think that means you're going to be a great emergency physician. I still think that you are going to be a matchable emergency physician. Let's talk a little bit about the below average student, right? So I think there are several variations of like why this student might be below average, and so your advising is going to be tailored to what makes a student below average. Is this a student that has like multiple remediations in their preclinical or their clinical coursework that's going to be a red flag on their application cycle? Is this somebody who just doesn't seem to quite grasp emergency medicine like their peers? Is this somebody that struggles interpersonally? Is this somebody that just doesn't communicate well with patients? So why is the student below average is probably the first thing that you want to figure out so that you can help figure out how to help them best. The other thing for this student is, I think it's really helpful. This is kind of like the sick person that comes to the emergency department. This is somebody that I load the boat for if I think that they're a potential like match issue. So at least at our institution, we have like long-term clinical coaches for these students that they're paired with, or doctoring coaches. I don't know, it's probably called something different at everybody's institution. And then we have like a community system for our students, so everybody's got a community mentor. So if I have a below average student that is going to go into emergency medicine, but is gonna like probably face some difficulties matching there, I'll start reaching out to those people so that I can start to get some perspective better from them as to like who the student is as a person, but also be able to help with that like mentoring load, because this person's gonna need a lot of advice, a lot of briefing on like rereading of their personal statement, talking about their application cycle. Does anybody else have any advice for how they deal with their below average students?
These are the students too that just you have to really build that relationship and trust so that they're talking about everything with you, so that they'll come to you and then you have this extended relationship during interview season, where like definitely during interview season, like we're talking weekly of like how are you doing, what do we need to do, do we need to think about anything else, and having a plan before that, of course, but really that close communication I find for like those students is what's really important for us as well.
Yeah. And I find the students that are like able to communicate in a really efficient manner are the ones that do well, because they like listen to your advice, and they answer your emails in a time that's like able to be like, oh great, I added those 10 programs that you told me to add. I think another thing to think about is probably your below average to average students are going to take up the majority of your time, just like the sick patients in your emergency department, right? Once like the fall hits, my AOA students, like they send me an email like once, like, yeah, I got 25 interview invites. And I'm like, okay, like I'll see you at match day. Like you probably don't have a whole lot of things to impact them, but the below average student are the people that I'm like reaching out to other program directors, clerkship directors. I'm refining their list. I'm talking to them on the phone. I'm talking to them off the ledge, like that kind of thing. So let's talk a little bit about professionalism concerns, and this is more from like the student level, and I think we've covered this, so I won't belabor the point, but it's something that I'm like upfront with the students that, hey, if we have a professionalism issue, either from a faculty standpoint to you, I want to hear from that from you, but I'm also going to be upfront if we hear that there are going to be some administrative or professional issues that we've encountered on the student end, we're going to like deal with that up front. Does anybody have like a mechanism that they deal with like the professionalism students, the professionalism issues from the students while they're on their course or beyond?
We include it in their grade, so if they, don't show up to something, don't turn something in, don't answer their emails, or have significant concerns on administrative failure or administrative assessments, then we get an extra grade. We just tell them that up front, and they shouldn't be surprised that they always are.
Do you guys put it in their slow then?
I
Or do you
think
like reflect that
it
their
really-
grade was?
It depends on the situation. Like, if somebody, their alarm doesn't go off and they don't show up on time till like a small group session or something, probably not. But if that, if that student makes a huge deal out of it and like doesn't, accept the responsibility and means something else, like that might go into it. Like how they respond to it may.
So if there's a pattern of behavior. Yeah, I had a student that had to check in for a kidney stone one time, so I'm not gonna fault them for having to have that taken care of. Anybody else like deal with putting professionalism issues in like the written commentary on their slows, or how else would you deal with it?
Depends on the level of professionalization. But like you, like our comments, they reflect their entire future ahead of them. So I'm trying to be a little tempered down some of these things. More than I really like a face-to-face with the student and talking about professionalization.
Yeah, I think that can be like one of the most challenging things for me when I'm like writing the slowest. If there is a professionalism issue and I'm putting it in there slow, like that's going to be a very difficult thing for them to overcome in matching in emergency medicine. So I think being transparent with the students, like, hey, we've had this issue, and we're gonna have to make that clear. So I'll wrap up and we'll go on to the next lecture, but I would just say, as we said, advising students can be really hard, but I also think it can be one of the most rewarding things that we do rather than, sitting down and doing student grades or, writing a lecture or, reviewing things. I find the mentor-mentee process to be one of the most rewarding things about being involved in the clerkship director team. From our standpoint, we try to get objective data so that we can advise our students the best we can. And we try to be transparent with the data that we have of the students so that they start to know what their application is going to look like. Make sure that you've got a good way to work to build relationships with your mentees. So it's been nice the past year going from like all of the Zoom meetings with the students to like actually getting to see them face to face every once in a while. And just be open that we're going to have an open line of communication. This is the first year we're actually starting a WhatsApp for our students so that we can kind of ping them at a large scale rather than just email them and hope that they respond. And then don't be afraid to enlist outside help from other mentors for the student too when they need help. Any questions?
I would also say, this is from the legal office perspective, but if you don't think someone's gonna match, leave them your student affairs teams. They should not be they have their finger on the pulse, but that's the time to triangulate your parallel plan pathways and so making sure that everyone's aligned.
Yeah, that's a great point. Yeah, something that we do is as well as that way SOAP day is less painful if we've been giving them advice to do something that